What would you say to a patient that was considering getting a hair transplant done at a clinic that does 10 surgeries a day? What would your what would you say to them to maybe discourage them or to give them reason for pause if they know that many surgeries are being done at the same time as theirs by that surgeon if there is one supervising surgeon or by that clinic?
Hi, Mr. David. You would agree with me that there are so many variables about hair transplant. There are so many variables which are peculiar to the patient, variables peculiar to the clinic, and variables peculiar to the growth of grafts when placed in the body. So there are so many variables which cannot be controlled. So I try my best to control the variables which are under my control, and that is harvesting and slip making. I do harvesting, the complete harvesting, and the complete slip making in every patient that I do. And you would realize that hair transplant is a very laborious procedure. It is a tiring procedure. You work under very high magnification, you work under very bright lights, and there's a lot of concentration required in doing microscopic work. So therefore, it is not possible for a surgeon to do more than one large case, or at the most, another case which is less than 1,500 grafts. So therefore, I try to do the best I can for the patient by restricting the number of patients that I do. And in all my cases, I am the primary surgeon. I do all the harvesting and all the slip making myself, and I supervise the whole procedure myself. So that I feel gives the patients the best outcomes possible. A patient who is not well researched, who has not done his proper research, is not a good patient for me. I do not really aspire to get such patients who have not done the research and who do not know the difference between a clinic which does one case in a day and another clinic which does 10 cases in a day where you don't even get to see the doctor.
What's interesting is once you start talking to different ethical, very well-trained, highly skilled surgeons around the world, no matter what country it is, I notice you get many of the same answers, which are, I don't even want to work on those people. It's very cool. I really respect your point of view on all of that. It's very cool, Dr. Bhatti. Well, all right. Well, stay tuned for part 3 with Dr. Bhatti. My last question for him.